Dr. Amina Zubedi, welcome to you with the Vancouver Prostate Center, and Mark Mall, a champion with Prostate Cancer Canada.
Good morning.
All about the cause. Before we talk about the research and the event, I want to talk about your experience, because the wording, living with prostate cancer, as opposed to saying fighter, survivor, when were you diagnosed and how did you choose and really focus on that mentality?
July 3rd of last year. I remember it distinctly. And what happened is the urologist said, was giving me the diagnosis, and so I very quickly went to my lawyer hat and I said, what are the choices? What are the pros and cons? What would you do? And there we made our decisions as to how we're going to deal with it. And then I went back and just started charging ahead with life and dealing with stuff as it's come along.
And this was a part of early detection, too, with the testing available.
Right. I feel really, really fortunate. Doing my PSA tests every year, I would have no idea I had prostate cancer otherwise. It just came up on the test. And as I understand, 1 out of 7 men get prostate cancer in Canada at some stage. It makes no sense to me why people wouldn't be getting tested every year. So I feel just really lucky.
Well, the tests go a long way, and Dr. Zubedi, when we look at the research, so many events happen, we raise money, feel good about it, and then wonder what was the impact, and you've been working on a special treatment for this incurable cancer.
Yeah, absolutely. I think that's because of the money that is raised by Prostate Cancer Canada. We are today doing kind of research to help patients. We are doing the research in it. We have like a big portfolio, not only in our center, but when we look about it in all Canada, from diagnosis, prognosis, but also for treatment for patients. Where we see that patient that they were treated with the cornerstone treatment for prostate cancer, which is hormone therapy, some of those patients that they become aggressive, their cancer become aggressive, and we don't have now treatment for it. And the money raised by prostate cancer can fund this type of research. For instance, in my lab, we received a large grant last year, and we are developing drugs specifically that can help and cure patients with aggressive cancer.
What's been one of the biggest breakthroughs for you looking at the work being done in the lab?
Yeah, what we identified a protein that is very important for the survival of this aggressive prostate cancer called neuroendocrine prostate cancer. What is mean that your cancer, the prostate cancer, become like a brain. And we identify this protein, also called surprisingly brain-2, that is responsible for the growth and survival and the aggressiveness of the disease. And with funding from Prostate Canada, definitely from the money raised by PCC, and thank you to the donors that you are capable now, and we are already developed a drug that can kill the cells, not only in a petri dish, but also in animals. And we're hoping that in the next year or two, we can move that forward to the clinic. Definitely what we know about it, translating your research from the bench side to the bedside, that we hope that we can help patients with this deadly disease.
Early detection with this work so important. And Mark, for you, next weekend, an important event. Tell us about the Step Up Challenge.
Yeah, it's 5th annual. Essentially, we climb stairs of 7 of our tallest towers here in Vancouver, but it really pales in comparison in what Digby goes through on a daily basis upon his diagnosis. If you're itching to get your grouse grind, climbing in, this is the event. People can still participate. Register online at prostatecancer.ca/stepupyvr. Today's a special day, as we all know. It's Pink Shirt Day. I brought my pink tie, but people can go out, buy their pink shirts today, wear them next Sunday, and join me in this particular climb. It's our 25th anniversary with Prostate Cancer Canada, and really, all of us do the work that we do for Dr. Zubedi, for Digby Lee, for everybody else out there, and the folks that come out and raise awareness and raise funds in early detection, so important.
Well, it's an important cause. We've got the website details on screen for you and on our Facebook page. Listen, thanks to you all for sharing what's being done, and it's important seeing this work. And Digby, thanks for the courage and the perspective too.
Yeah, my pleasure.
All right, thanks, Doctor. Thanks, Mark. We'll take a break.
Thank you.
More to come here on BT. Watch